So the body is built to die. Like we are physically built to die. We're physically, we can give birth. Some people can give birth, right? And the baby can like survive birth. And the body has built-in mechanisms to help us die, just like birth. So the first thing that usually starts happening is our hunger and thirst mechanism in our brain, that the thing that makes us hungry and thirsty, it shuts down. So we don't feel hungry and thirsty. That's why like most people dying don't really eat and don't really drink. And then the family is constantly like, eat, drink, eat, drink, eat, drink. And the person's like, I'll try, but it's hard because the body is preparing itself. And the body knows that the drier, the more dehydrated it is, the better it actually feels when you're at the end of life. So dehydration in a healthy person is different than dehydration in a dying person. A dying person's body will actually try to make itself dehydrated. The body is trying to do that because it knows it's dying. And if it goes into ketosis, it releases endorphins, it dulls pain, and it makes you feel like euphoric and good. So it's crazy, right?
I'm sitting here like, because I'm thinking like, this is why, like I don't know if you follow the UFC. I don't follow them either. Hey, honey, hi. My daughter just came to my door. There's a UFC fighter. His name was Ben Askren, and he got like a really bad disease, and he lost a bunch of weight. And I was like, this always kind of be a thing when somebody gets a disease or an illness that's going to kill them. They get really, really, really skinny, but it looks like a dehydration, like bone skinny, not just like straight up whatever else way that you lose weight. So what you're saying now that when you think about all the people that you see who had illnesses and you see how thin they get, and you see that's a natural part of the process. It's just like, it's like, even just knowing that makes me feel better. So sorry, I just had to say that.
Same. That's even as a hospice nurse, I was surprised. Like I didn't know this stuff as an ICU nurse. So, and I want to make sure I'm specific with this. This is for people who are dying. Okay. So I'm not being like, because we talk about ketosis and stuff when you're like working out. It is it's different because you're still eating. So this is like for people who are dying. The body is preparing itself, shuts off the hunger and thirst mechanisms. That's why they're not eating and drinking so much. If you want them to have a natural death and they're purposely like on hospice, never force them to eat or drink. If they want to, great. If they can eat whatever the F they want, they can drink whatever they want, they can smoke, they can do whatever, right? Just allow their body to be the guide because the body knows what's going on, right? So it stops a hunger and thirst mechanism. It increases sleep. So they want to sleep all the time. Calcium levels go up. So a side effect of calcium levels going up is sleep. So they will sleep all the time. Their body's basically cocooning, like allowing itself to slowly die. Now, that's going to keep going for like 6 months, let's say, and just more and more and more of it. And then the part that gets the most confusing is the actively dying phase. That is the last phase of life. And that's where most people feel like, oh my God, this was awful. My loved one was not waking up. Their eyes were open, but they weren't making eye contact. They couldn't close their mouth. Their breathing was different. They had like a gurgling noise to their breath. It sounded like they were like choking on their own saliva. And if you don't know what's going on, I don't blame you for being like, this is awful, because your loved one does look different. But all those things are happening because of biological reasons. So the actively dying phase, which is never shown in movies, P.S., they always show someone like giving a big long monologue and then being like, just drifting off to sleep. Like that never happens. Usually lasts for sometimes like a week, maybe a little less. You'll be fully unconscious, so not waking up at all. Your eyes and mouth may be open because it takes muscles to close your eyes and close your mouth. And all those muscles are relaxed. So your loved one is relaxed, okay, so, which is great. Now, they're not making eye contact with you because they're unconscious. So their eyes may be open, but they're not like looking at you because they're not online anymore. They're unconscious. They have changes in breathing because there are metabolic changes that are happening in your blood chemistry, which makes you breathe different. So they're not breathing because they're trying to get air, or their body is just metabolically changing and it's making them breathe different. It's almost like you can truly see that when your consciousness or your soul or whatever you want to call it, right, is not really there, your body is just a body, right? And it's doing what it needs to do to shut down. So you'll have those changes. Also, one thing that happens is we make saliva in our mouths unconsciously all through our lives, and without even knowing it, our body just does it because it feels good to not have a dry mouth. And then our body will also unconsciously swallow that saliva all throughout the day, all throughout our lives. At the end of life, that stops happening. Our body's still creating saliva because it's uncomfortable to have a dry mouth, but our brain is a little offline, so it's not having us swallow that little bit of saliva. So sometimes it'll collect in your mouth. And because your mouth is open, you're breathing, that wet breath goes over that little bit of saliva, and it can create like a gurgling noise. So a lot of people will say, my loved one drowned on their own fluids. That's not happening. That's not what's happening most of the time. I suppose every once in a while there could be something that could be happening that maybe that is what's going on, but 99% of the time it's not that. It's a little bit of saliva that's making a lot of noise, and people don't like that noise. But again, 99% of the time, your loved one is okay. How do we know they're okay, even though they're unconscious? Because it's like a baby. Babies can't say, I'm hungry, I have a wet diaper, I'm teething, so I'm fussy. They like cry differently. They're restless. They are showing you they need something. And a dying person will do the same. So they will be restless. They will moan. They will, if you touch them, they'll guard. If they're not doing that, that means that they are relaxed and the natural process is taken over and they are okay. And to me, learning that was so comforting. And seeing it over and over again was so comforting. Like, wow, our bodies really take care of us at the end of life. Our bodies know how to die.